Give us your name, please.
Good afternoon. My first name is Darinka, which is spelled D-A-R-I-N-K-A. And my last name is Mileusnic-Polchan, spelled M-I-L-E-U-S-N-I-C-P-O-L-C-H-A-N.
Where are you employed?
I'm an associate professor of pathology at University of Tennessee Medical Center here in Knoxville, and also chief medical examiner for Knox and Anderson counties.
What is a medical examiner?
The medical examiner in Tennessee is a physician, and in a larger jurisdictions such as metropolitan areas including Knoxville, Memphis, Nashville, it's a forensic pathologist. So I'm a forensic pathologist who determines the cause and manner of death in cases when the death is sudden, unexpected, without medical attendance or due to violence.
What is a pathologist?
A pathologist is a physician who specializes in the field of pathology, and the field of pathology is pretty vast. It deals with the clinical pathology, which is laboratory studies and tests and interpretation of those, and then anatomic pathology, which is examination of the tissues and organs taken at the time of the surgery, and performance of autopsies. And then within anatomic pathology field, forensic pathology is a subspecialty that essentially utilizes autopsy as a tool to determine the cause and manner of death in the scenarios that are usually deaths outside the hospital.
I was hoping, can we move that, your microphone there? And now, what is an autopsy?
The autopsy is a post-mortem exam procedure that consists of several different steps, and I'll talk about the forensic autopsy, because it really starts at the scene. I have to know the details about the scene investigation in order to be able to approach an autopsy in the right way. And then once the body comes to my office, then the set of steps needs to be undertaken, such as positive identification of the body, examination with frequently x-rays, looking for injuries on foreign objects, and then detailed external examination, where everything has to be recorded meticulously with the emphasis on the injury. And then after that, the kind of core procedure would be opening of the body to examine the organs, to look for diseases or injuries, document them. During the process, we take fluids such as blood, vitreous fluid from the eyes, and sometimes other samples for toxicology. And then we examine the organs and return to the body, and as the final result, I complete the autopsy report, which in forensic cases in Tennessee is a public record.
Now, what is your educational background that permits you to hold this position?
I'll kind of briefly summarize. I graduated from medical school, University of Rijeka, which is spelled R-I-J-E-K-A, in Croatia in 1986, and then I did a year of internship with the affiliated hospital. It's essentially a 6-year program in Europe. And then after that, I spent 4 years at the university doing research and teaching medical students, and that was the same university, medical school in Rijeka in Croatia. And then in 1991, I came to the United States to kind of continue and hopefully finish my research, and I enrolled at Loyola University Medical Center in Chicago. That's where I studied in the neuroscience graduate program. And then in 1995, I enrolled in pathology training program at Loyola University Medical Center. It was anatomic pathology, neuropathology training program, and that training took about 3 years, and then the 4th year of training was forensic pathology training, which I finally completed at Cook County Office of the Medical Examiner in Chicago. I graduated from the PhD program and the pathology residency program in 1999, and I did remain as the assistant medical examiner for City of Chicago after that, and during that time I took my board examination, specialty boards. So I'm board certified in anatomic pathology and forensic pathology.
And how many autopsies have you performed in the course of your career?
It was years ago that I was stating that it was over 3,000, so obviously it's in the thousands, and I don't have the exact number.
And have you testified in court before?
Yes.
And have you been deemed an expert before in
Yes.
the field of forensic and anatomic pathology?
Yes, in Illinois, Cook County, Illinois, a couple of surrounding counties such as DePage, and of course in Tennessee for the last 11 years and testifying in multiple jurisdictions in East Tennessee.
Including federal court?
That's correct.
We would offer Dr. Mileusnic-Polchan as an expert in forensic and anatomic pathology.
No objection.
All right, so call.
Dr. Mileusnic, did you perform the autopsy on Mr. Hugh Christopher Newsom?
Yes.
And performing the autopsy, did you take photographs or have photographs taken?
Yes, photographs are always an integral part of the forensic autopsy and become actually evidence following the procedure.
And the photographs, did they assist you in explaining your observations and findings to the jury?
Certainly, especially in a complex case like this, yes.
If you could, it's probably just easier for me to jump right in to the photographs and just let you explain to the jury your findings as to the autopsy of Hugh Christopher Newsom.
Certainly, yes.
Exhibit 21.
Exhibit 21 is the original photograph taken at the scene of the body as it was found. Mr. Newsom was discovered around noon on Sunday, and that was the January, as I remember, January 7th, or will it be 7th? I'm trying to remember 7th, yes. I apologize. In 2007. So what happens in that situation, when the police is notified, they immediately have to notify the office of the medical examiner, and then whoever the assistant medical examiner or the investigator on call is goes to the scene to assist the police. Essentially what we do a kind of parallel investigation with the police. We collaborate, but we don't really work under the police. We try to really reach some sort of agreement that the scene belongs to the police and the body, in essence, belongs to the medical examiner. So I have to be notified, and myself or my representative have to be there to make sure that nothing gets changed, altered, or essentially messed with in essence. And that's why here we can see exactly how the body was recovered before anything was touched or the body was moved. And you can see a couple of things. First of all, obviously there is a lot of thermal fire injury on the body of Mr. Newsom, and it's kind of gradual. It goes from like a really heavily involved area to slightly less dense, and then area of sparing, such as feet. Another thing that it's interesting to notice is that there was an outline of sort of like a cover shroud that the body was originally placed in. Some fragments of that shroud, which turned out to be comforter-like material, was originally on the body or surrounding the body, and some fragments of that comforter were emanating kind of gasoline-like odor. And obviously, whatever came with the body to our office was recovered and saved to be analyzed. So obviously we have outline of that kind of shroud or cover that was on the body. One thing that it's also noticeable that the upper part is really heavily involved with charring, and it was greater than 80% of the body surface that was involved with the heavy fire damage. And the reason for that is the remnants of the clothing was still present on the upper part, and the head was covered actually with some sweatshirt, and there was some blindfold and a gag, and all of those kind of clothing particles, of course, attracted more fire and elicited more burning, as opposed to the lower part of the body. The clothes were not present, so that's why it was a little bit less involvement with the heavy charring. And also, you can notice that although there are some contractures because of the fire and heat-induced changes in the muscles, you can notice that the kind of arms, especially the left arm, is still folded behind because there were some ligatures present there originally, and also there's ligature on the ankles that you can see a little bit more closely. And of course the placement is interesting, and that's next to the train tracks where he was found.
Exhibit 229.
So just a close-up of the ligature. So there was 219. Yes, the close-up of the ligatures. Couple of things are worth mentioning. Again, number one, you can see where the comforter shroud stops, and that's where the heavy that's singeing and fire damage also kind of stops. And then there is a belt. It was a leather belt, a little bit fire damaged, but it was encircling the ankles twice, and it was secured through the belt the metal part, I'm sorry, I'm just blanking out, it's getting late for me. But anyway, under that belt also there was another piece of a ligature, which was a torn piece of the kind of clothing or sheets, bed sheets or something like that. That, interestingly enough, later on, a similar piece of kind of torn sheet appears at a different scene. And then another thing is that again we have sparing of the feet, which helps us then notice dirt and mud, and more of it actually was on the soles of the feet. So there was definitely a lot of dirt and mud, which to me meant that Mr. Newsom was walking with no socks, with no shoes on the muddy ground of dirt in order to be at the scene or wherever he was eventually shot. So anyway, what I meant is belt buckle. I apologize. It was just a moment of
220.
weakness. So now again, better look at the upper part of the body. Again, it's heavy fire damage. Again, outline of the comforter. And again, what's noticeable as a contrast to the lower part where we don't see any clothing items, there were some remnants of the kind of boxer underwear still present. There were two shirts, t-shirt and a dress shirt, remnants of which were kind of tucked in protected parts such as under the arms. And then there was kind of heavy sweatshirt that completely covered and encircled the head in a couple of layers, and it was secured around the neck area with the strings from like a hoodie or one of those sweatshirts that has a string around the neck.
221.
And then close-up of that particular area again, the several layers of the heavily fire-damaged sweatshirt, and one area of blood staining, and that's because of the gunshot wound that was located on the right side of the head. Now, this is actually a very important image because it shows several things prior to the body being moved. And you notice later on as the body is being relocated and moved from the scene to the autopsy room that some of that kind of head cover fragments, because it's essentially just charred, and then it's very brittle and it breaks down during the removal and transport of the body. So that's why it's really important to see the scene at the scene as is, so you can notice that originally it was completely covered in the head in a couple of layers, and there was a defect in the sweatshirt. It means that Mr. Newsom was shot through that sweatshirt at the scene.
This is number 22.
Now this is part of the removal process. Now these are the individuals from the investigating agency and the emergency medical services, but the investigator and the assistant medical examiner are at the scene when this is happening. So the body cannot be moved or altered unless the medical examiner or my representative basically approves of that.
Okay, number 222.
So as the body is removed and comes to the autopsy suite, and that's where the autopsy is performed. The first photograph, the evidence 222, shows exactly the body as is, and you can notice a couple of things did change during the transport, and that's that there was again breakdown and fragmentation of the charred head cover.
223.
The photographs are taken as is, the front and back, and then what you can also notice, there are a couple of things. Number one, that the arm that was folded in the back, originally there were both arms actually folded and tied in the back. What happens is with the heat and fire-induced changes in the muscle cause the contractures, what we call like a pugilistic, like a boxer-like position. And that's why the right arm moved. Well, the left arm could not move because that's exactly how it was originally positioned at the scene. And I also know that both were tied here because there was some residual ligature, kind of ligature remnants still present around the wrist, number one. And number two, you can see there's a lot of charring on the back. Had the back been completely on the ground, that would not have happened. So obviously the arms and they're folded in the back, and that's why the fire has access to the back. The areas of sparing mean that these are the areas that the body is in contact with the ground, and then again you can see that the gradual involvement, more severe upper body, a little bit less where you have just that comforter surrounding the body, and then sparing of the feet. And then the feet have a lot of mud deposited on especially on the soles and the heels.
Number 224.
Now the close-up in the right side of the head is viewed here. Again, you can see the breakdown and fragmentation of the charred sweatshirt. It was tied and secured around the neck with a string. And then as that breaks down now, a couple of things become evident. Number one is the gunshot wound on the right side of the head that now becomes readily visible. There is also a bandana that was used as a blindfold that is now under the layer of sweatshirt. And also there's an additional feature, and it's the gag in the mouth. There was a sock that was stuck in the mouth that was partially preserved under the covers.
225.
And now it's the features that I just mentioned are better viewed and apparent here. Of course, the gunshot wound to the right side of the head, it's just about the ear, and some of the blood that is coming from the ear is induced by the fracture of the base of the skull. Bandana is more evident, and it's actually an interesting I guess appearance of the bandana, because as I went to the scene on the companion case, there was a similar bandana that I noticed at the scene. Also, the gag, the sock in the mouth, partially is kind of pushed out because of the gas and edema or fluid that is coming from the lungs that can passively happen because of the heat exposure and the shrinking of the lungs because of the heat. And then it was secured, obviously it was secured with the kind of string that looked like the shoelaces. Partially preserved head, actually, face helped us with the identification of Mr. Newsom, and also helped us with the determination of the range of fire for the gunshot wound of the head, one of the gunshot wounds on the body.
226.
And again, the bandana that appeared to be like a dark, possibly blue, now it's stained with blood and partially charred in the ends.
227.
And then the gag that was in the mouth, part that was exposed to the fire, of course, has changes from that, and then the shoelace, the string that was securing the gag around the lower face.
228.
And then obviously that's the gag that now I unfolded, and it's the blood stain because of the gunshot wound to the head that induced a lot of hemorrhage originally from the ear, in the mouth, and obviously from the head wound.
229.
Now after the hair is shaved, the gunshot wound of the right side of the head becomes apparent, and there are several features that are important to mention. Obviously, gunshot wound of entrance. It has a nice central defect, and gunshot wound of entrance in general is going to have a central defect because when the bullet, the missile enters the body or the skin, it takes a part of the skin with it. So there's part of the skin that goes with the bullet inside the head. The tearing, so this is a central defect. The tearing, what we call lacerations, they're usually indication there are a lot of gases creating under the skin, under the scalp, as the missile enters the head, and that's going to happen particularly when the gunshot wound is very close range, and especially if it's a contact gunshot wound. So all those gases, the gunpowder and the soot with heat and flames essentially. If it's a contact gunshot wound, cannot really escape anywhere else, but it goes under the scalp and basically elevates it and tears it. So that's evidence of like energy release due to a contact gunshot wound of the head. And another evidence that it's a contact gunshot wound is that you can notice that this skin, the scalp, is not singed and it's not fire damaged because the sweatshirt protected it in essence. So I can say confidently that the black soot in the margin of this wound is the soot and gunpowder residue coming from the gun. And of course, more importantly, it was not just deposited on the scalp or on the skin, it was deposited deep within the wound, including the bone. And there are a couple of photographs to show that. So that obviously indicates that it was a contact gunshot wound of the head.
230.
And that's exactly one of the features that I just discussed, and that's evidence that it's a contact gunshot wound of the head. We are looking at the inside of the skull cap. So usually at the time of the autopsy, we're going to make a cut in the back of the head between the ears to connect it, and then we have to deflect the scalp to the front and the back to visualize the skull, the bone, the skull cap. And then we have to make an incision with a special saw in the bone to remove that skull cap to expose the brain. So when we remove the skull cap and then when I flip it, that's exactly what I'm seeing inside. I'm seeing the imprints from the blood vessels. All of these, that's what the blood vessels course on the inside of the skull. And then you can see the characteristics of the gunshot wound of entrance, and especially contact gunshot wound of entrance, because it creates internal beveling. So when the bullet goes through the bone, it's going to cause beveling of the bone, and the beveling is going to be indicative of the direction of the wound. If it's on the outside of the skull, that means that it's exit. If it's on the inside of the skull or the skull cap, that's the entrance. So on the inside of the skull, I have the beveling, internal beveling, and then on top of that, there is a black-gray soot and gunpowder deposit on the bone itself. So again, another indication that it's a contact gunshot wound.
238.
So one of the reasons why we performed complete autopsies, number one, indicate the injury, the damage, the document the damage. This particular bullet, of course, as it entered above the what we call parietal temporal area above the ear, went through the right hemisphere of the brain, the right half of the brain, and then went steeply down, involving the brainstem, one of the parts of the brainstem which connects the brain with the spinal cord, so-called pons. Those are the areas where a lot of vital centers are. So this particular bullet then from the hemisphere went to the brainstem, and that's how it crossed the middle of the head area, and then ended up kind of carving out or entering the base of the skull on the left side, and that would be kind of at the level of the eye, behind the eye, what's so-called Peter's temporal bone, kind of level of the eye and ear, inside the base of the skull. That's where the bullet was recovered, and it's a bullet that was deformed. It was a lead bullet, which I recovered. Now, number 3 just pertains to the fact that this was the last of the 3 bullets recovered. It doesn't really mean that it's the last fire. What this means is that as we go through the autopsy procedure, the head is always the last area that we examine and open. So that was the last area of the body that I approached to examine, and that's why it was the last bullet recovered at the time of the autopsy.
232.
For orientation, this is actually the second gunshot wound on the body. Usually in my report, I describe gunshot wounds in the anatomical order, going from top down. So this was the number 2 wound described. For orientation, the head would be in this area. So this is the right side of the neck, and this is the right shoulder. So right in the region where the shoulder and the neck meet, so the neck and the shoulder meet, there was another gunshot wound of entrance. And this bullet involved the muscles in the back. So this is in the back, and entering the skin, through the skin, into the muscles. And then involves the muscles on the right side, in the right side of the neck, and the nerves in the right side of the neck. And these nerves are actually very important, because brachial nerves, that some of them are going to go into the arm. So obviously that would be not necessarily a wound that would cause death, because the major vessels were not harmed, but would cause some sort of disability, such as inability to use the right arm. So that's the gunshot wound number 2. Doesn't have any characteristics of a contact gunshot wound, meaning that as I examined the skin and examined the tissue deep inside the wound, I could not find any soot and gunpowder residue. Granted, some of that could have been on the clothes, but of course clothes are just remnants remain on the body and they're heavily damaged with fire. So I couldn't really comment on the distance or range of firing for this particular wound. And it's a little bit fussy, but that's the first bullet that I recovered, and that's of course lead bullet. Doesn't have any copper or any alloy jacket on it, and it was the first bullet because it was easy to access. As we made a Y-shaped incision on the body and deflect the skin, the neck is going to be the first area exposed, and that's why I recovered a bullet from the muscles of the right side of the neck.
234.
The evidence 234 is a close-up of the back of the body of Mr. Newsom. For orientation, this will be the upper back, shoulder area. This is the left arm, and it's left elbow that is now folded. That's the elbow that was still on the back, going over across the lower back. And this is the charred left hand, the palm of the hand. So obviously when the body was set on fire, that arm was in that position, and I can tell by the preserved skin under the forearm, and there is a residue of the ligature. So there's still a little bit of a faint impression on the wrist, on the left wrist, that this ligature left, but of course the fire damaged the ligature. Now it's loose under the wrist. And the parts of the preserved gluteal area, buttocks, is where the body was resting on the ground.
235.
So the better view of that area after the arm now is moved shows a couple of features. Partial preserved skin, again where the body is in contact with the ground. Preserved area where the arm was originally kind of tied and placed. And then there is an area of damage, pretty heavily damaged, because obviously the folded forearm or arms made that accessible to the fire, of course. It's an important area because in spite of the heavy damage due to the fire, there was still evidence that that's where the entrance of the third gunshot wound was. So this is the area where the third gunshot wound entered the body.
236.
I should say the third bullet or missile entered the body. So again, it's the beginning of or entrance area of the third gunshot wound. Again, so the upper body would be here. This is now the lower body, and this is the left flank, left lumbar area. The defect in the middle actually is going to be the entrance gunshot wound, and of course, because of the heavy fire damage, I cannot comment on the range of firing because it will be all obscured. Even if it were contact, it will be obscured by the heavy fire damage. So this is the entrance area of the for the third bullet.
237.
And then as I'm going through the muscle, I can see the defect now extending deep into the muscle because the trajectory is going upward from this lumbar area up.
243.
And I'm sure we're going to show the third bullet eventually, but just to let you know that this particular bullet did involve the muscle in the back and involved the spine. And as it involved the spine, actually it severed the spinal cord or damaged the spinal cord heavily. So that would be a bullet that would disable the victim, and he would lose the control of his lower extremity of the legs. Now, this essentially is the sum of all the kind of clothing item residue and some of that shroud comforter that was the body that was originally kind of folded and shrouded in. And the remnants that we are seeing here are part of the boxer underwear. There are no pants, no jeans, no remnants of anything. And usually, even with a heavy fire, something of the pants or jeans always remains, particularly the area around the waistline, because it's kind of heavily folded, several layers. So that's something that always remains, but there was absolutely none in this case. Some of the underwear is preserved. Some remnants of the T-shirt are preserved, and they're usually where the body was in contact with the ground, so spared, and then under the arms, the areas where the clothing items remained, or parts of it remained preserved. There's some parts of the dress shirt, and then parts of the comforter, and especially the comforter parts are the ones that emanated quite strong odor that to me it was gasoline-like. But of course, we cannot make the determination at the scene. That's why we collect this evidence and send it for testing.
Now, also, did you examine the anal cavity?
Yes.
And if you could you tell us about your observations and finding of Chris Newsom's anal cavity?
The entire anus circumferentially was bruised and damaged. There were several lacerations or tears in that area. So with that observation like that would not be certainly sufficient. Now I have to also mention that particular area, as you remember, the part of the buttocks, the gluteal area, was preserved because the fire could not reach all the way in that region. So it was spared as far as the fire is concerned, and it was relatively easy because of that to examine it. So obviously the trauma that I'm seeing with the naked eye is obvious, but I still have to confirm it by taking sections from the area. So I did take multiple sections to confirm that what I'm looking at is truly bruising, truly tears or lacerations. So when I sample it, I look under the microscope, and then I confirm not only that it's the injury, true trauma, but I can also then look at the kind of components of the trauma and see if there is any tissue reaction to the trauma. That might tell me that the victim survived, and for how long maybe he survived this trauma to the anal region.
And now, how is it that you can tell how long he survived after the trauma?
No, I cannot be very precise, unfortunately. I cannot really narrow it down to in a minute, and sometimes we have to be very careful even about whether it's a couple hours and how many. I cannot be that precise with the microscopic examination. But there is always very similar kind of healing process when it comes to injury in each and every human being. We can differ individually a little bit, but in general, some main physiologic processes are always followed, regardless of who we are. And that's essentially that originally when the tear or bruise happens, and if you really observe your own injury on your body, you're going to notice a set of changes, color change or whatever. Well, first thing that really happens before even any color is going to change is that if the bleeding happens in the tissue, the blood is regarded by our own body and our immune system as a foreign material in the tissue. So that's why the body is going to send sort of cells or defense mechanism to kind of wall off the area of the damaged and to heal it. So the first thing is going to be kind of tissue and vessel reaction, blood vessel reaction, before anything else gets engaged in the immune system. And that's where the first changes are going to come from the vessels. The blood that is now from torn vessels coming to the tissue is also bringing not just red blood cells, but it's bringing white blood cells. And as white blood cells there are several different types of white blood cells. And based on which white blood cells come to the tissue, I can then say, this is going to be day one, and with the day one, this is going to be, maybe first 6 hours or very beginning of the trauma versus the second part of the day one, and then day two, I'm going to see another part or type of white blood cells coming to the tissue, and then day three is going to be another type. So within the first day, I can say this is all now day one. And now I'm trying to be more precise and say within this day one, is it going to be the first part of day one after the injury? So I can tell, this is the first part of day one that I'm seeing this injury. And then within that kind of part of the day, or hours now, I'm dealing with the hours now, how many changes do I see? So I can say, okay, I see that Mr. Newsom survived for a short period of time. I'm seeing that the white blood cells are starting to gather in the area of the damage, and they're trying to enter the tissue. But they're not in great numbers, and they're not far from the area of damage, meaning that they have not migrated far. So I can say now with some sort of certainty, medical certainty, and kind of physiologic certainty that this is happening within the first couple of hours of the damage. So yeah, I can say yes, he was alive when this happened, and he lived for at least a couple hours after the damage, because I'm seeing tissue reaction to the damage, but I know that he didn't live past those couple of hours. So that's how essentially I'm trying to narrow down this time frame. So yes, he's alive, he lives for a short period of time, it's a couple of hours, but I cannot narrow it more than that. And after that, then he dies from the gunshot wounds.
And now, as far as the gunshot wounds, is there any way for you to tell us the order of the gunshot wounds?
The order is hard to really guess precisely, but there are a couple of things that we can look at. We can look at the range and the distance. So the only one there was a contact, and the only one that really would be immediate reason for death would be gunshot wound to the head. So I can say that if there is multiple shooting, obviously the shooting usually, especially with the multiple gunshot wounds or bullets fired, shooting is going to happen until the victim falls down and doesn't move anymore. So that's basically how we approach the case. So which wound would cause the victim not to move anymore? Would that be gunshot wound to the head? That's a given, because that's a deadly gunshot wound that involves the vital centers in the brain. And with involvement of those vital centers, there is no way that he can live any amount of time. As a matter of fact, when there is brainstem involvement, that's pretty much very quick death right there at the scene. So the other two wounds, the gunshot wound to the neck, would not be major disabling. It would impair the kind of movement of the right arm, but it's a survivable wound. And the second wound, the gunshot wound to the or third, so to speak, because of the order, anatomical order, would be the gunshot wound to the back. Now, it's a survivable wound, most likely, but it does impair the ability of the victim to move. So that wound would definitely bring him down. And then also we have one more area of damage, and that was the bruise on the forehead. As I remove the scalp and I look at the tissue under the scalp, between the scalp and the skull, the bone, there was actually a large 2.5-inch bruise on the forehead. Obviously, he's still alive for that bruise to happen. So again, I can analyze the situation, which gunshot wound will bring him down. Possibly the gunshot wound, because he's still alive. He'll be alive after the gunshot wound to the neck, and he'll be alive after the gunshot wound to the back. So just by that order of kind of deduction, I can say that either the neck or the back are number 1 and number 2. And the last one, the number 3 wound, is the gunshot wound to the head, because the disabling wound that he is definitely coming down, and he will be on the ground. And by collapsing to the ground from a position that you're not standing anymore because you already have gunshot wound to the back, and you know you cannot use your legs, that the impact falling down from that wound would not be as great as impact coming from the wound on the back if he were standing. So.
And what about what did your injuries tell you about when the blindfold and the wrapping to the head, when was that placed on in relation to the gunshot wound to the head?
It was placed prior to the gunshot wound to the head, because, as you can see from the scene, now, as you remember, just from the time of the autopsy, everything was so brittle that it fell apart. But at the scene, before anyone touched it, there was a defect in the sweatshirt and the wrapping that was on the head. So obviously, the blindfold, the gag, and the sweatshirt on the head were prior to the gunshot wound.
And then finally, what about the fire? Setting him on fire.
Oh, the fire was definitely the final event, and the reason I'm saying that because one of the basic questions that always police or the law enforcement has for us is, was the victim alive when set on fire? And I could say confidently that he was not alive, he was dead. I know that because we always measure carbon monoxide level, which is one of the fire byproducts in the blood, and that was very low. It was not. There was no indication that there was any inhalation of carbon monoxide. Second thing that happens with a fire like that would be inhalation of smoke and soot that would be deposited, if nothing else, on the tongue or upper airway, and frequently with fires like this throughout the airway, and there was none. So obviously those two findings were a clear indication that Mr. Newsom was not alive when set on fire.
Okay. I have a last critical piece. So for the anal penetration, we know that he was alive.
Yes.
Was set on fire with an accelerant. You said that we know that's elation. We know that he was alive.
Yes.
Was set on fire with an accelerant. You said that we know that's last.
That had to be the last, yes. He is not alive anymore.
The gunshot wound to the head, you said that's a fatal shot?
That's the fatal shot, yes.
The gunshot wound that to the shoulder, how would you describe that shot?
Minor disability, the wound that would cause minor disability, meaning the impairment of the right arm.
And then the gunshot wound to the lumbar region.
Mr. Newsom would be paralyzed below baseline.
And as far as the bound, blindfolded, and gagged, all we know is that that happened prior to the head.
That's correct.
Head vision.
That's correct.
Now, as part of your autopsy, are you able to determine the trajectory of the bullets into the body of Mr. Newsom?
Yes, and again, that's another reason for the autopsy, recovery of the bullets, which are the evidence, and then that's a mechanism to ascertain the trajectory of the wound.
And it would be okay with the court? Would you be able to step down and, using a mannequin, demonstrate to us the trajectory of the bullets?
Want the mannequin brought around?
Please, sir.
Sure, you can step down. You'll bring the mannequin.
Thank you. Please. I'll wait this.
I'll go in the anatomic order, just like it's in the autopsy report. So the first wound, just to show everyone, that's going to be the entrance in the what we call parietal and temporal area above the ear. That is the contact gunshot wound and enters the right side of the brain, crosses the midline as it damages the brainstem where the vital centers are, and then the bullet remains lodged in the base of the skull on the left side. And that was the deformed bullet. The reason why it's so deformed is because the base of the skull is very, very thick, and it's going to change the relatively soft left organ. The wound to the neck area is again at the junction of the neck, shoulder, and kind of upper back, and that's the bullet and trajectory which kind of skip the vessels miraculously, because there are a lot of large vessels here. Just goes through the muscles. It does involve the nerves that kind of gather here in a plexus that come from the kind of cervical spine, and many of them are going to supply the right arm area. And that bullet doesn't come through, but it kind of remains right here, relatively superficial in the muscle of the neck area. And then we have the third entrance. And actually, just make it easier on me, I'll do this because it enters in the left lumbar region, as you recall, that fire defect that has a central hole in the middle, and then goes relatively steep upward, transecting and damaging the spine and the spinal cord approximately 6-7 thoracic level, and then the bullet was recovered close to the spine as it crosses the midline and then becomes lodged in the muscle next to the spine. So essentially, the main trajectory for this particular bullet would be downward and right to left. Here it's from back to front and slightly right to left. And the main trajectory of this one would be from left to right and relatively steeply upward.
And so, Dr. Mileusnic, would your findings be consistent with Mr. Newsom? Being bent over, suffering a gunshot wound to his lower back, still being down, suffering a gunshot wound to his shoulder area, and then a contact wound to his head.
Right. The one that is relatively simple to understand, of course, will be the one that is straight. The wound that is in the lumbar area, the main understanding really is that the victim would have to be the best scenario, so to speak. There's never really just one scenario in discussion, but the best way, the easiest way would be in this particular direction to administer the steeply upward trajectory. And of course, for this particular wound, is if the victim was already down, that the close to the ground, that the bullet coming from an upward sort of up-down motion or direction of the gun.
Now, additionally, Dr. Mileusnic, the location where Mr. Newsom was found, are your findings consistent or inconsistent with that being the location where he was actually shot?
That could have been location. I believe the area was canvassed, and I don't recall that there was any blood anywhere else. Most of the blood and the bleeding was present on that kind of comforter that was surrounding the body. And as I recall from the scene, there were not evidence of the body being dragged or anything like that. That could have been carried by several individuals, but obviously from the dirt on the feet, we know that the victim did walk outside. So it would make sense that it would be in the vicinity of where the body was found.
Now, using this mannequin head, could you demonstrate on the mannequin head with a marker? Yeah. I was just going to ask you to show this for me. Is that okay? Yeah, you can use that. Thank you. Oh, yes.
There were two areas of hemorrhage when I looked at the tissue under the scalp and close to the bone. One was on the right side that was related to the bullet. So there was one area, and that was bullet related. And there was then a completely separate area on the front of the head that was relatively large, and it was about 2.5 inches. And that's conclusion that was completely separated from the gunshot wound, and obviously came from an impact with the surface or with the ground, and as the victim fell down.
Did you also examine Mr. Newsom's stomach content?
Yes, and as you recall, there was really no any particular residual food in the stomach.
How long does it take for an individual for their stomach to empty out?
It varies depending on the type of the meal, ingredients taken, and the size of the meal, of course. But no matter what kind of meal one consumes, it should be empty within 6 hours.
The bullet number 2, exhibit 233.
Yes, that's the bullet that went through the kind of back, neck, shoulder area, and obviously it's a very nicely preserved bullet because it involves only soft tissue and muscle.
Okay, sorry. Do the lights. Exhibit 240.
240 now is a close-up in the autopsy room that a couple of things are important again. The belt as a ligature, and then another ligature that's kind of floral pattern, multicolored, torn sheet or some bedding, something like that. And then of course, area that was not covered with the comforter, that it's not involved in this fire, and some of the mud and dirt on the sole of the feet. And we'll see in the rest of the body, the extremities in particular showed a lot of blistering, kind of blistering and then charring of those blisters, which frequently goes along with like a flash fire or very sudden fire that can be seen with accelerants when they're applied.
241.
And then just a better view of the some of that ligature burned off, floral kind of pastel color under the belt, and some of the kind of very hard wooden-like plants were all kind of mingled and caught in some of that, some of those ligatures, so that were also found and brought to the office.
242.
And then the feet, all of this, that's essentially dirt staining from the victim on the ground with no socks and no shoes.
Okay, let me if I can approach and show you exhibit 396. Do you recognize exhibit 396?
Yes, exhibit 396 is the an accurate copy of the autopsy final report for Hugh Christopher Newsom. And it was autopsy number 9 from the January 2007.
I'd like to move this in as exhibit 396.
All right,
What is our very last number? Yes, 434. We'd like to move in the styrofoam head as exhibit 424. Mr. Newsom's body, what is a fresh death versus was his body, was it like recently there or had it been there a while? I don't know if I'm asking the right question.
Well, you're basically asking the question whether there was any signs of decomposition, like a delayed discovery. No, as a matter of fact, when he was discovered on that Sunday, on the 7th, the autopsy was done the next day in the morning, on the 8th, and there were no indication of any post-mortem, what we call autolysis, breakdown of the tissue or decomposition. So obviously it was that occurred relatively shortly prior to the discovery and the autopsy.
Would your findings at the autopsy be consistent with his death occurring within 12 hours of him being found?
Yeah, he was found around noon that Sunday, and all the findings are consistent with the death occurring anytime between 11 o'clock, midnight, somewhere around that time. I cannot really be precise with the hour, but that would be a time frame that would correspond to all the findings found in the autopsy. So 11 o'clock, midnight, Saturday and Sunday.
Oh, yes. And did you also take rectal swabs from Mr. Newsom?
Yes.
If I can show you 425 and ask if you recognize Exhibit 425.
I'll have to
Sorry
cut
about
it.
that.
So this envelope that is sealed as an evidence contains several specimens recovered at the time of the autopsy, and these are the original specimen, I guess, pouches that I used at the time of the autopsy, and this is actually my handwriting with my initials. Rectal swab is one of them, and then the oral swab from the mouth is the second sample.
Move that in as Exhibit 425. And your autopsy of Mr. Newsom, was it consistent with Mr. Newsom having a blunt object forced inside of his anus?
Yes, there was quite a bit of bruising and swelling in that area that I would imagine the object would be the most plausible reason for that.
Can you talk to us about making a determination about the fire occurring after the death?
Yes.
Let me show you Exhibit 398 and ask if you recognize Exhibit 398.
Yes, Exhibit 398 is the report from Tennessee Bureau of Investigation, and it's performed on the blood sample taken at the time of the autopsy. This is actually one of the toxicology reports and has carboxyhemoglobin concentration of 4%.
I'd like to move this in as Exhibit 398. And again, Dr. Mileusnic, what does that mean?
What that means is that there's actually a great possibility that Mr. Newsom was a smoker, and with the smokers, sometimes carboxyhemoglobin can be actually even up to 10%. I know that it's not fire-induced because anything that would really matter that would be fire-induced would be 30% or greater. So obviously in this case you have something that is just an artifact of most likely smoking, and not even a heavy smoking, potentially occasional smoking.
All right, if we can go to Ms. Christian's autopsy. Did you also perform the autopsy on Ms. Christian?
Yes.
And on this one, did you actually go to the scene?
Yes, I did go to the scene because it was a Tuesday. Actually, that was around time that most of the homicides I performed in the office myself. And when the call came that the body was found, that it could be related to the autopsy that I already performed on Monday, I did go then to the scene Tuesday.
show you Exhibit 34.
Exhibit 34 is one of the photographs, and we also took a set of photographs at the scene because that's what we need to do as we go with the police. And it's one of the areas in the residence. There was a kitchen. The residence was relatively small. We came from the main entrance and then entered through that kind of front room directly into the kitchen because all the kind of doorways were wide open. And that's in the kind of far corner of the kitchen, and the what you see, the dark blue, like a trash bin, that's where the body of Shannon's body was found.
Exhibit 35.
And as soon as one of the officers at the scene lifted the lid, it was obvious that there was a human body inside because the piece of skin or fragment or segment of skin was visible here in spite of all the different covers on top of it. And then it's a better view. Yes, Exhibit 36. Again, it's a better view. It's a little bit deformed, of course, because you have an adult person now stuffed really in this bin. The shoulder area is visible. What you see here, some of the bags, actually the body was not just put in the bin, but it was in 5 different large garbage bags and then in this trash bin. And then some of the ligatures were applied to it, and on top of that there were kind of different pieces of kind of bedding and some curtain pieces, and so it was all on top of the body. What we did is, as soon as we kind of assessed the scene, took all the photographs and kind of get familiar with the surrounding and what could have transpired and how the body was found, then our suggestion is, and actually that was me there, our suggestion was just to put everything untouched the way how it is, just put the lid back, put it in a tarp, and then transport it to our office, and then from that point on that we would then take the body and go step by step, try not to lose any evidence.
245.
And this is now in the back area, intake area of the forensic center, where the body came from, the intake area here. And again, it's in a sealed tarp, as is with the autopsy number on top.
246.
And then again, that's in our facility. Again, you can see everything is the way it was at the scene. Nothing was perturbed, nothing was touched. And then we just went layer by layer from the pieces of the comforter and the curtains and bedspreads all the way to the body to record everything that was on the body, present and around the body. And then what was also important is the finding of this particular bag, because had anybody actually disturbed and moved the body before or prior to me assessing it, it would have actually changed possibly the wording of the kind of cause of that. And the reason I'm saying is that there was this is Shannon's face. She's kind of facing kind of down a little bit at an angle, and a white bag was originally tied in the back, so it would be the back of the head. The front of the, or the face is completely covered with this bag, and then the area that was tied kind of got untied as the trash bin was transported to our office. So obviously the bag, plastic bag over the face would prevent breathing. So that's one of the reasons, one of the mechanisms why Shannon died.
247.
Now we are removing all the layers, and then you can appreciate the different bags that we'll see later on. In addition to the this white bag covering the face, kind of getting untied in the back, some of her clothing items are visible, and some of the ligatures, because there are several different ligatures that were on Shannon that kind of forced her in a fetal-like position in order to, I guess, put her in the bin.
248.
And then it's just different view again. You can see how the face is completely covered with the bag. She cannot breathe like that. Also, she is really in a very awkward position, kind of in a fetal position, and that position itself would be very detrimental to her ability to breathe. So obviously that's another kind of mechanism that would be contributing to the plastic bag over her face, and that would be positional asphyxia. And then another thing, with all the items on top of her and the lid being on top of the bin, that would be a third component of this asphyxia, which is confined space asphyxia. So essentially, she was not able to breathe with all those elements and parts of the findings that we noticed.
249.
That's one of the literatures close to the neck area that shows like a triple knot, and we took pictures of all the literatures and all the knots just to make sure that that we preserve them, because at that time we were ready to take Shannon out of this bin, and we were making sure that nothing gets altered, or if it does get altered, at least it's documented.
250.
And essentially, that's what we did as we placed the bin on the autopsy table. Took the bin out, and I can see the 5 different bags. We took them essentially layer by layer, and then her body now as it emerges from the bags.
251.
Now, one thing that we really tried not to disturb, that's definitely going to be the bag over the face, so we can take a better picture of that, and that's definitely going to be an important mechanism in asphyxia or lack of oxygen and ability to breathe. And then again, the ligature around the neck that is kind of folded a couple of times, and also brings the lower extremities close to the neck, forcing her in a fetal position.
252.
And then again, just another view again from the back, completely covering the face. Obviously, it was tied originally, now it got untied. Ligature around the neck, and then some of her clothing items. And that's essentially the only thing that she had was that striped sweater and a little camisole underneath.
253.
And this is the position that Shannon was in the bin. Essentially, this is the position in which she died. The ligature now better visible with the kind of semi-sheer curtain-like material bringing the knees and thighs close to her chin and forcing her in a fetal position. And then again, another ligature looked like possibly some kind of thicker, denser curtain, or maybe even bed cover. It was hard to tell. That had some blood on it, and again was forcing her thighs against her belly to kind of keep her in that position and exposing the anogenital region.
254.
Now the complexity of this ligature is really better. The kind of semi-sheer curtain is better appreciated, and that's the ankles with bringing them to the thighs and the knees. Next to her face, and you can actually see the way how Shannon was positioned in the bin, that the face, the left cheek was actually pressing against her knee. That's why it's all kind of indented. Another thing that it's also important to notice is the distribution of so-called lividity, or settling of the blood after that. When one dies, then the circulation stops, and then the blood essentially follows the just kind of dependent gravity kind of directed settling in the vessels, and then from the vessels finally goes into the tissue and becomes what we say fixed. And lividity or that discoloration of the body, depending where the blood settles after that, essentially goes along with the kind of first 24-hour position of the body, because after 24 hours it's completely fixed, and it was fixed in Shannon's case. Prior to that, if had the body been moved, that lividity could have shifted. So in this case, the lividity remained as is, meaning that most likely she was in that position for some time in the bin. Another thing that is also noticeable here is that kind of purple blue discoloration of the lips, and we can see that in a close-up later on, and that's essentially what I would call cyanotic or cyanosis, which indicates the lack of oxygen. That's why the blood if the blood cannot get oxygenated because one cannot breathe or prevented from breathing for different reasons, it won't get enough oxygen to remain bright red, so it becomes kind of bluish purple, and that's how it discolors the areas where the skin is very, very thin, or where the skin becomes kind of mucosa, and that's lips are a perfect example of that. So that's cyanosis. Sometimes you can see cyanosis in people who have like a lung disease. They can become bluish purple lips because they don't get enough oxygen. Well, that's essentially the same kind of mechanism here. Lack of oxygen produces cyanosis.
255.
The ligatures were removed, and then a couple of features become evident. Number one, again, is that the lividity remains the way it is, and it really follows the pattern of her position in the bin. Again, the only clothing items are now just these two shirts, and actually there's something very interesting, and that's very unusual. The ligatures were removed, and then a couple of features become evident. Number one, again, is that the lividity remains the way it is, and it really follows the pattern of her position in the bin. Again, the only clothing items are now just these two shirts, and actually there's something very interesting, and that's the very unusual pattern of skin detachment or epidermis detachment. The reason I'm mentioning that is that this tells me that obviously her post-mortem period is a little bit longer than I would have predicted, let's say. It's definitely longer than 24 hours, meaning that obviously she was in the bin for at least 24 hours. Now I have to be careful putting exact time frame to these 24 hours, and the reason for that is that the residence was very, very, very warm. It was much warmer than your normal, whatever, like 68, 72 degrees, 74 degree residence that we usually have in our homes in the winter. So that would cause post-mortem changes to be a little bit accelerated. I see this detachment usually after like a 72 hours, but in this case it appeared a little bit earlier, I think, for another reason, and that's that not only was it very warm in the residence, so the process of decomposition is accelerated, but it was distributed in like a really weird area, kind of just confined on this area of the body, and the body itself emanated like a really strange odor. One of the things that we have to kind of pay attention to is not just visual what we see, but also odors coming from the body. And the human decomposition has a certain specific odor, but this is not odor of regular human decomposition. It's a kind of chemical odor. So obviously the something was applied in this area that kind of changed that post-mortem smell that I usually encounter, but I could not really define exactly what it was. So that could be consequence of accelerated decomposition, number one, because of the warmth in the residence, number two, because a lot of the settling of the blood is happening in the lower part of the body, because that's how she was positioned in the bin, and then number three, application of some sort of chemical post-mortem that changed that odor, that gave it chemical odor after oral examination.
256.
And that's one of the photographs at the time of the autopsy. Now, the first part of the exam was actually done on the date of discovery, which was the 9th, January 9th. And the reason why we postponed the second part is that the crime scene specialists, they tried to, or they attempted to lift potentially some fingerprints from the body. Sometimes it can be done, the fingerprints from the skin from the body can be done. In this case, they were not successful. And one of the reasons, because of that premature accelerated decomposition and the detachment of the skin, and also there was a lot of humidity in those bags that the body was positioned in, and that would prevent the fingerprinting on the body. That's why we see this kind of grayish brown or black discoloration. That's the attempt to fingerprint the body, which sometimes can be done. The identification photograph shows a couple of more features, and that's again that purple-blue discoloration or cyanosis, cyanotic appearance of the lips because of the lack of oxygen, and then also pressure mark with indentation on the left face, and that's because of the body and the head is pressed against the knee and against the side of the trash bin.
Looking at Exhibit 256, did you also notice anything about her eyes?
Well, the eyes remain open. Now, this is not really necessarily indication of any particular mechanism of that, but obviously, at the time of that, the eyes remained open, and they had kind of dark gray discoloration or line across them. Again, it just goes along with the process of dying. Now, it's not specific for like a relatively slow dying process, but it can be found in those deaths.
Exhibit 259.
259 is the photograph of the inside of the upper lip, and there was an area of damage. It was on the gingiva and it was on the inside of the lip. This sort of damage is what we call like an abrasion or like a kind of deep scrape. Obviously, it can be induced by a couple different mechanisms. One of them, if the lip is pressed really hard, and then the teeth can scrape the inside, or if there's some forceful insertion of an object in the mouth, that's what can happen. We can see it on the kids if they're forcefully fed sometimes, tearing the frenulum, but we can see it with the adults. Obviously, there is something or some object forcefully forced into the mouth.
Could that be caused by forcing a penis in and out of her mouth?
It could happen, certainly, yes, especially if she's clenching her teeth.
Exhibit 260.
There's a close-up of the neck area. Some of the discoloration is just, again, lividity settling of the blood because of the bent neck area. We took the close-up because one of the concerns is always going to be strangulation, but there were no signs of strangulation. All the findings were really findings pertaining to the kind of slow asphyxia because of the bag over the face, because of the position, fetal position or positional asphyxia, and confined space asphyxia because of the trash bin.
261.
The close-ups of the hands were done. This is now the next day. I removed the fingernails to look for evidence. Sometimes
Moving to evidence, Exhibit 326. And lastly, Exhibit 343. You recognize Exhibit 343?
yeah, that would be the bin and with that kind of bent lid that was at the scene that the Shannon Bible was recovered from. And, so one picture that I wanted to show that, as you recall from the photograph, the way how she was positioned and the head bent against the knee, there was actually impression on the forehead that was within the hairline, and that was because of the head being pressed against the side of the bin with this line here creasing the forehead and leaving an impression.
I can move to evidence Exhibit 343. Dr. Mileusnic, I know you told us that can you tell us any exact time of death?
Not precise. I certainly cannot give the minutes, and actually even the hours I have to give an interval. I cannot really give anything very precise. Just from looking at, from the time of discovery to the time of her disappearance to the changes in the tissue, because even in her situation I had to take samples of the tissue from the inside of the lips or mouth and from the damaged area in the anogenital region. I can kind of create some sort of time frame and interval, and that's the only thing that I can really kind of deduce from this autopsy.
Would your findings be consistent with Miss Christian being dead the afternoon or evening of Sunday, January 7th, 2007?
The only thing that I can really tell that Shannon could have died in that interval of the a late afternoon or Sunday evening to early hours, like a Monday morning hours, anything kind of before noon. And the reason I'm saying that is that because there are already some changes of the composition that were there. So I would at least need some 24-hour interval to accommodate all those changes that I'm noticing now. They are accelerated because of all the issues that I listed, but again, that will actually bring me more toward the early Monday morning or late Sunday afternoon.
And the same thing with Mr. Newsom. Would your findings be consistent with his death occurring at around 1:45 a.m. on Sunday morning?
Sunday morning before he was found, yeah, it's an interval, a couple hours that could have been, I said, anytime around midnight, and then when I say around midnight, that's going to be, plus minus a couple hours. I cannot be more precise than that. It all depends actually on the scene investigation, who saw the victims last, and any other reports that are resolved or investigation other than my own.
And if his death occurred at around 1:45 a.m. on Sunday morning, what would be the range of time for that anal penetration to have occurred?
That happened within a couple hours prior to his death. So let's say he dies, and we say that it's close to like a 1 or 1:30, sometime around that time. That to be then bring that penetration around 11:30, midnight, I would say the latest.
There's one thing I think we've got the wrong exhibit number on the styrofoam bid.
I'm sorry, it should be 405.
This is 405.
Well, the reason why I said it as 4, I put 424.
Okay. 424.
424, yes.
Sorry.
Good evening, Dr. Mileusnic.
Good evening.
When you're investigating a suspicious death, you take a lot of care to make certain that the evidence is preserved, right?
Certainly.
Particularly anything concerning any evidence with the body itself, right?
That's our really main focus. So I don't collect evidence from the scene. That's what the law enforcement does. I collect the evidence from the body.
That's right. And you certainly did that in this case, right?
Yes.
With respect to Ms. Christian, right?
Yes.
And Mr. Newsom.
That's correct.
And you collected a number of items and you sent them off for analysis that you don't do in your office, right?
That's correct.
DNA analysis, right?
Yes.
And ballistics analysis, correct?
That's correct, yes.
And fingerprint analysis, right?
Yes, that's all done by Tennessee Bureau of Investigation.
That's right. And you're aware of the DNA results in this case, right?
Yes.
And you're aware that of all of the items you sent to the TBI for DNA analysis, Mr. Thomas was excluded in those results, right?
I don't remember how they worded it. I don't really recall because it's not really, it's too much information to begin with. I don't remember the details of the DNA analysis.
Do you remember taking a couple of hairs from Ms. Christian's back during autopsy?
Yes, everything that I can find on the body I submit, yes.
And do you recall that those were submitted for mitochondrial DNA analysis?
We submit them and then the TBI decides what to do with them depending on the condition of the submitted evidence in the hair in particular.
Yeah, and they actually send the reports back to you once you've submitted them, don't they?
No, actually no. Unfortunately they don't. They send the reports back to the either law enforcement or the Attorney General.
Okay. So you said you're familiar with the reports, correct?
I've seen reports and in situations like this, if the case goes to trial, I do look at the reports, but as I said, I don't really, I shouldn't say bother remembering everything because I have enough of my own information to remember. And that's something that would not alter the way how I testify in any particular case because I testify to the findings on the body. I don't testify to the findings of the laboratory findings.
Is it your understanding that the oral swabs that you took from Ms. Christian, that those matched with Thomas Toppins?
Yes, I'm going to have to object because I guess what I'm hearing her say is that she's not aware of the TBI findings. She is here to testify about her findings on the body. So that's going to have to be your say.
Well, Mr. Jonathan, I don't think the case takes issue from opening statement on it. If there were no positive DNA status of your claim. It's not really, you're just repeating what I think everybody knows.
Okay, that's fine. I do want to put in, since Dr. Mileusnic sent or recovered the hairs that were subjected to mitochondrial DNA analysis, we have a stipulation we'd like to put into evidence concerning the mitochondrial DNA analysis that shows that it was not Mr. Thomas.
All right.
And we have that as the next number exhibit. 425?
26.
426.
426.
426. Got it? Thank you. I have no further questions, Doctor.
Doctor, thank you. All right, members of the jury will recess the trial from 9 in the morning. Thank you. Is that the state proof?
I think there's going to be one more stipulation that'll take 10 seconds, and we're going to double check on our exhibit list to make sure we've moved everything into evidence, but I don't anticipate any live testimony, any further live testimony.
Okay. Is that, does the defense want to make a motion now, or?
I think we can make a motion now.
Excuse me?
I said I think we can make our motion now.
Okay, if the state doesn't have any problems with them making a motion now.
No, we can do
Okay.
that.
We'll wait.
Until we formally rest, I
I
guess.
think they've got to formally rest before we make Rule 29.
Okay. All right then. We'll recess until 9 in the morning, but I'll meet with counsel in about 5 minutes where we've got still another draft of the jury instructions, and also I want to hear counsel's comments about it and suggestions about the instructions. So, thank you.
Judge, could we approach you?
Sure.